6 months of tests and running behind many doctors. Thousands of rupees later, the diagnosis was still missing. We have all heard this, right? And experienced it for our loved ones or probably even ourselves. Isn't this all common? Hello, patients and doctors. Let us see a real story of how multiple doctors missed, but ChatGPT caught the incorrect diagnosis in seconds. One prompt on ChatGPT and bam, it gave a probable cause in seconds. And yes, it was accurate. What we are about to see might just change the way how you look at AI and healthcare forever. Let me introduce you to Maya. She is 37. For the last 6 months, she had had fatigue, morning stiffness, hair thinning, brain fog, and mild mood swings. All doctors said it was stress. One prescribed antidepressants. Another doctor asked for multiple diagnostic tests. Another doctor gave even incorrect medication, which caused more side effects. But then the patient turned to ChatGPT. She got treated, and not only better by these doctors, but even a better accurate diagnosis from ChatGPT. Let's dive into this real story and check out how this can help all patients and all doctors. Let's get into the real demo now. So, this was the prompt that was used. So, the patient asked, act as a rheumatologist. I'm a 37-year-old female having morning stiffness, fatigue, hair thinning, low mood. What conditions could be considered and what tests should be done? Please ask me three, four clarifying questions. We can add one more. I am from Delhi, India. So, ChatGPT is giving a response. Certainly, as a rheumatologist, I can tell you that morning stiffness, fatigue, hair thinning, low is possibly because of autoimmune, endocrine, or psychiatric conditions. Common differentials include rheumatoid arthritis, especially stiffness lasts for more than 30 minutes. Then there are other conditions which ChatGPT has explained. All right. Then it also tells initial tests that you can order. Okay, which is complete blood count, androcyte sedimentation rate, thyroid, anti-nuclear, and so on. But it is also asking questions, right? Because we told ask me questions. This is where the game changes, because usually doctors don't ask such level of questions. They may ask some basic probing. Let's see how many questions. Now, because I originally suggested ask three to four questions, it has asked me four questions, right? And here are my responses. So first question is, how long does your morning stiffness last? So I gave it 30 minutes. Then I said, does it improve with movement? Yes, after 1 to 2 hours. Do you notice joint swelling? I mentioned no swelling. Then it asked, does it have rashes, mouth ulcers? I said no ulcers. And any recent weight changes? I said no. What I'll do is, when I'm about to respond, I'll add just one more thing here. I'll ask me detailed questions to help identify the cause of my chronic joint pain. So we are going to continue asking that, right? So let's see what it does. So it's responding, it's saying thank you for the detailed responses. Since your morning stiffness lasts for 30 minutes to 2 hours, okay, this suggests a possible inflammatory or autoimmune origin. Through early or mild diseases, it is still possible even without swelling or rashes, right? Then it says joint pain, stiffness, which joints are most affected. It's asking me basically, right? Fingers, wrists, knees, back, hip. Then is it symmetrical? Is it both sides? In the left side, right side, is it the pain? Is the pain same? Do you feel your joints are warm, stiff after rest, or feel tight? Is there a pain during sleep? See the kind of questions that it is asking. Then it is saying, do you experience dry eyes? Your eyes are dry, or your dry mouth? How it is trying to correlate so many things with the health, right? Which usually the doctors may not go to that level of it. And they will probably just straight away give you diagnostic tests or some medication, but it is asking probing questions. Let's see, any episodes of fever, mouth ulcer, chest pain, shortness of breath, so and so, right? And it is also given something new, which is also given an explanation that fingers turning white or blue in cold water. Wow. Any history of miscarriage? Then fatigue. Is your fatigue constant or worse in the morning? Do you experience brain fog, memory issues, or trouble concentrating? Do you meet physical activity, right? So it is asking so many different questions, you see. Again, hormonal. When was your last thyroid test done? Any family history of autoimmune? Do you have vitamin D or B12 levels checked? Once you provide these, then we will check for more, is what it is saying. So I've drafted my responses for all the questions. Affected joints. Yes, in the morning. Symmetry, the pain, both knees and both wrists. Yes. Stiffness. Again, suppose history, one miscarriage in 10 weeks. I have provided that. History, last test 8 months ago showed borderline TSH, which was 5.8. Then family history, mother has hypothyroidism, cousin diagnosed with lupus. So vitamin B12 was borderline. So these kind of things, right? So example, sleep disruption. Yes, occasionally woken up by knee pain around 3 to 4 a.m. Dryness, which is mild in eyes, right? Especially in air conditioned environments. So I've given a very detailed list. And once I provide it, let's see what is the response that ChatGPT comes up with. Because it has asked me very detailed questions. I've given very detailed responses as well. So, clinical impression about it. You are 37-year-old woman, symmetrical joint pain, mild so and so. This constellation is strongly suggestive of systematic autoimmune disease. Okay, it has given a differential diagnosis, early rheumatoid arthritis because of so and so, systematic lupus something. Anyway, mouth ulcers, fatigue, low grade so and so. Then it is giving undifferentiated connective tissue disease because of lupus, RA, but not fulfilling criteria for one. Autoimmune thyroiditis because of borderline TSH, and so much. So it is also further telling me recommended lab tests. Okay, there are so many lab tests, inflammatory markers, thyroid nutrition, and other things which are next steps, right? So remember this, you can use this as a secondary opinion. Do not replace your doctors. Doctors are awesome, doctors are great. We just have to make sure that there are many times some doctors may not out of their memory remember all this tests, remember asking all these questions. There are so many that you can do. What you can further do is, suppose you don't get all this test done right now, try this last one before getting the test. So you say simulate a virtual case review by a team of super specialty doctors. Now you're not one doctor, you are rheumatologist, you're neurologist, you're endocrinologist, you're toxologist, nutritionist, and for someone, right? You just try to get everything together. Now become a team of super specialty. Now you start asking questions, right? So then it will give you a beautiful case summary. Okay, patient is so and so, panel of doctors. Suppose rheumatologist. What is the rheumatologist response? The response is because the joint stiffness pattern is highly suggestive of early inflammatory arthritis. Now see, neurologist. Neurologist, the response is chronic fatigue, brain fog, muscle loss, if true atrophy, because it could reflect central sensation as in a B12 thyroid mediated neuropathy. Then there is endocrinologist response. Then there is an environmental toxicologist response, right? Because Delhi's air, water are critical. There is so much. It could flare some autoimmune problems. Heavy metals like lead, mercury, arsenic could be doing some things, right? We've got something more as well here. And there's a unified plan of action. So all the doctors have given something. But of course, they are also giving possible treatments. But we cannot determine this till we get all the tests done. If you want a PDF summary or a test checklist, I would say yes, I want a test checklist and a summary of my diagnosis. Let's see this, okay? So it's giving a full personalized summary, okay? And then it'll tell me what are the tests that I need to do, okay? All of it is coming. It can also give me, you want to ask more, you can ask about, say, nutrition, you can ask about diet, you can ask about sleep, yoga, whatever, right? But those things we will do in our upcoming sessions. So for today, what we have done as a demo is we have just started with how we can start using ChatGPT for a second opinion. Remember, guys, doctors are awesome. We just need to make sure that some things that doctors can miss, we just want to get that covered with ChatGPT. Suppose tomorrow we can do a demo about some medicines. What are the side effects? How does it impact you? We want to understand a little better. Those kind of things. We'll try all of it in the next few days of series. Stick to this, subscribe to this channel. Trust me, you will have wonderful learning.
Subscribe to Career Story 60 and unlock your ChatGPT superpowers.